Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes or so discussing the marketing of chronic special needs programs, a subset of the Medicare Advantage programs, and we'll go into some detail about these programs, how to locate them, how to market them, among other things. Today's presentation is being recorded, and that recording link and the other information that we reference throughout the course of the presentation will be sent by email to all who have expressed interest in today's presentation. You'll notice in the software package too that there's a section in there for questions. If you would, please use that. We have everyone muted on the lines at this time, but we will make certain that we answer all the questions that aren't covered through the course of the presentation as well. We will start with a little bit of level set with Premier Marketing. We are a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler working through independent insurance agents, and we offer contracts for the different programs that we contract with at the highest possible commission levels with recruiting contracts available to those who qualify. We do so through a full insurance portfolio, and that includes the Medicare programs such as Medicare Advantage and Medicare Supplement plans, Part D prescription drug programs, and a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, and hearing programs, critical illness cancer plans, and hospital indemnity programs. When you look in the Medicare Advantage space, we have the national carriers available for you through our organization, and many of these programs now offer chronic special needs plans. We also offer a good sampling of the regional carriers that can make a difference for you in your market. And that same philosophy carries over into the prescription drug arena, where those plans are available for you through Premier Marketing as well. When you look at the Medicare supplements that we offer, you see a very robust portfolio of products, and we have different support programs set in place to help you be successful in that space as well. Ancillary products, in each of those categories, you have the national leaders available to you, and we find that many agents are very successful in offering these plans not only to address a specific need of our prospects and clients, but also utilize these as a means to market and establish additional streams of revenue to their agencies. You'll notice on this program also that we are now offering MD Live, a telehealth program as well. When we look at the Medicare market overall, we see a very burgeoning market. You don't come on a presentation like today without someone mentioning, like me, the aging of the baby boomers, the wave of the silver tsunami, 1 every 10 seconds, 10,000 plus people a day. But if you look at the Medicare program just based on age, you're missing a portion of it. And we see that there are some folks that reach the age of 65 and don't access their Medicare benefits immediately. They delay it for one reason or another. While that may be a lessening of the number of the total people based on age, we also have 1/6 to 1/7 of the population of the Medicare population that are accessing their benefits because of medical disability, and they are under the age of 65, and these are folks that really need our help as well. And so when we look at this diverse population, where 2/3 of the population have 3+ chronic illnesses, boy, that strikes right at home for today's topic. And we also see that these folks not only deal with health issues, but also with monetary issues as well, where income and savings are a bit of a challenge. And so having a portfolio of products that can help them address those chronic illnesses and do so within a budget is paramount to our success in this area. Because people have choices. They don't have to do anything when they go on Medicare. They can decline the optional Part B coverage if they wanted to. Most don't. And then there are a portion of the folks that stay with just traditional Medicare and pick up coverage for medications only. That's a smaller percentage than what we see across the board because many folks will take out a standardized, modernized Medigap policy, a Medicare Supplement program, or enroll in one of the Part C programs, the Medicare Advantage plans that we discuss in part today. When a person is first accessing their benefits in Medicare, we see a pretty even split between the Medicare Advantage and Medicare Supplement programs with the choices that are there, and we see a portion of the population that shows still with original Medicare only. Keep in mind that original Medicare only population may include folks that are accessing their care through the VA. They may have retiree coverage. They may be Medi-Medi. So there's a number of reasons why individuals will show in the percentage of original Medicare only. That doesn't necessarily mean they don't have any additional coverage. It doesn't mean they don't either. So it's something we need to be very adept at when we discuss the possibilities with our prospects and clients, because they're a diverse population and we need to help them with information that enables them to make a good choice for their health care moving forward. Part of that explanation is helped by understanding what all these acronyms are in the Medicare world. It has its own language, and so part of the follow-up to today's presentation will give you a link to an acronym guide provided us by Medicare, and that can be very helpful in our discussions with our prospects and clients, but also for our own self-interest. So when we discuss selling the Medicare market successfully through CSNP sales, one of the things that we need to emphasize right up front is what programs best fit an individual's situation during open enrollment period, throughout the year, in their everyday life. And it's important for us to be adept at asking the questions and doing an analysis that helps them with the information that delivers upon best choices. And in this circumstance, we're discussing the opportunity that folks have with chronic special needs programs, because they are still subject to the different election periods. We've just completed, not too terribly long ago, about a month and a half ago now, the annual election period. We are part of the OEP right now, and we'll discuss that in detail in just a moment. But these regular election periods are also augmented by the different special election periods, and there's a number of them that come into play. Medicare likes to speak to the 5-star special enrollment program. We see a number of good programs that are 4-star and up, and the majority of the Medicare Advantage population are in such programs that are 4 stars and higher. It also reminds us to speak of another special needs program, and that is for the folks that are challenged monetarily, we shall put it that way. And these are the folks that qualify for assistance with their medications and other medical costs through LIS and MSP programs. And then when we look at the election periods at all, overall, there's a number of them. But let's discuss OEP right now, because many times folks will say, okay, I'm looking at the different possibilities for this prospect, or I've got a client that now has responded to my outreach, even though we're past the annual election period. What can we do for them during OEP? Well, it's important to note that the government has different restraints placed upon us based on what we can say and do. And while this period runs for 3 months, it is a situation that applies only basically to the people that are already in a Medicare Advantage program. And it's a one-time election that enables them to make certain choices, where they can switch from one MAPD plan to another MAPD plan. They can switch from an MAPD plan to an MA-only program, dropping the drug coverage. It also gives them the opportunity to pick up drug coverage by switching from an MA-only plan to an MAPD plan. And you'll note in this circumstance that that's the only option that enables them to pick up drug coverage during this time of year. OEP is not an extension of AEP, where everyone has an option to create additional choices. They have to be in an MA program. So you're seeing switches from an MA plan, MA only program to an MA only program as well. That's allowed. It does allow the population to drop MAPD coverage and return to original Medicare, pick up a PDP program if they choose to do so or not. And it also gives them the opportunity to drop an MA program, MA only program, and go back to original Medicare and pick up a PDP program in that circumstance or not as well. There are certain stipulations that are placed on the beneficiaries, so we need to make certain that these folks know that if they bring this topic up, we can discuss it. Because, frankly, there are things that we cannot do because of CMS regulations. It prohibits agents and brokers from intentionally targeting or sending unsolicited marketing detail to enrollees in these categories during OEP. There are some things that we can do, some things that we can't. And this gives us the idea of the fact that we need to do business as usual during OEP and speak to the possibilities that an individual has in changing. And one of those possibilities is using a SEP, a special election period, for a chronic special needs program through our regular marketing techniques. If you look at that SEP chart, the get out of jail free card, so to speak, in these circumstances, you've got a number of them there that are a valid reason to discuss a change in coverage and a valid ticket to do so, because it also includes some of the special elections that are brought up because of the challenges we've had with Mother Nature over this last year. So what you will also have as part of the follow-up to today's presentation is a listing, as you see it here, an Excel listing from CMS that tells us of the different areas in the different states, the different counties or parishes that have an option for an individual to make a change if that option of changing during AEP was influenced by some of the weather that we accounted for or went through this past year. So watch for that as well. It's also important to note that in a pandemic such as what we're experiencing now, many folks think there may be a special election period for COVID-19 itself. Actually, there was, and actually, it's expired. So that's not a valid way of moving someone at this point in time. So why do we talk about all these steps all the different time? Well, as Kaiser Family Foundation has shown in one of their surveys, more than half of the people on Medicare do not compare their coverage options annually. They may not have reached out to someone. They might not have responded to someone. They may not have had someone reach out to them. So we're seeing in the circumstances that we run across in a new year, in this data, 57% of the Medicare beneficiaries do not review or compare their coverage options annually. What's that mean? Well, that means we're almost obligated to make certain that folks realize that not only do their coverages possibly change year over year, but it behooves them to look at a comparison of programs in order to make certain that we're minimizing their costs and maximizing their benefits because of their I didn't do it type of situation during AEP. And this is particularly important when we deal with folks who are older, have lower income, lower education levels, or impaired or poor health. We see this circumstance then where a good percentage aren't comparing those coverages. And when we're talking about folks that are battling chronic conditions, well, that falls in this category as well. It's also important to note that about a third of the Medicare beneficiaries report difficulty understanding the program at all. And that's why, as licensed and certified professionals in the area, it's our obligation to deliver not only the information that helps them with their choices, but do so in a manner that's comprehensible. That's in the plain language. That's one of the reasons why we speak of the acronym chart earlier, because we want to make certain that folks realize what an SEP is, what is AEP, what is OEP, and understanding not only those different types of regulations, but also then going into the different coverage types and helping explain how medications can cost different amounts in different plans, and there can be different expenses based on the programs that are being selected. It's also important to note that while the government is trying very hard to put out sources of information, that most Medicare beneficiaries don't use the official information resources that are available to them. We saw some changes in the Medicare Plan Finder last year with the creation of accounts and some of the different things that came into play, not to mention the change of the vendor that actually powers that site. But we find that most folks don't use that. And it is a valuable tool for us to help people understand those programs and changes. But it's also important to us as insurance agents that we realize it's not meant to be a sales tool. It's a delivery of information, and it can help us understand how to deliver programs as well. And we'll talk about that in a second. But it's really important for us because, hey, in the Medicare Advantage world, that enrollment is nearly doubled over the past decade. So whatever administration is in play in the government, we see that this is a very valuable option that most people perceive it as anyway, and it is an option that has the support of both parties in the government. It's also important to note that we're seeing an increase in the special needs programs, particularly in the dual special needs area, but we see an increase as well in chronic and disabling condition programs, the CSNPs. Why we're seeing a smaller percentage of that? Well, there for a period of time, these programs were not as widely available as the dual special needs programs. And we see a very limited number of institutional programs as well. We're seeing a greater proliferation of the chronic special needs plans, so we can anticipate this number growing over the next few years as well. So when we get down to brass tacks and we look at working with special needs plans, we need to make certain that we realize that these programs have been around for quite a while. They were actually created by Congress in the Medicare Modernization Act of 2003 as a program to focus on certain vulnerable groups of Medicare beneficiaries. When I served as the regional director for a large Medicare Advantage carrier in the past, when these programs first rolled out, they didn't even really give us a good definition of what a chronic illness was or what procedures had to come into play in order to enroll someone. That was, of course, prior to the MIPA changes where we have different election periods and pieces like that. But we see a program that has been in play for quite some time, reinforced by multiple pieces of legislation in the last few years, and is designed with specific benefits to help that certain vulnerable group of Medicare beneficiaries. And there are three types of SNP programs. There's the chronic SNPs that we'll talk about today. There's an institutional special needs plans, which are offered to folks that live in an institution. And there are the dual special needs programs for folks that have both Medicare and Medicaid. We do a number of presentations to help with information on the D-SNP programs and the entitlement or support programs that are out there that make people eligible for that plan. We don't speak so much of the institutional SNPs because in most circumstances, those are not available for marketing through the broker channel. Don't worry, you're not missing out on much there. The population in those is basically handled by captive agents within the different carriers, and they are not as widely available as the other two types of programs. You'll notice on this slide with the chronic special needs programs, boy, there's quite a list of healthcare circumstances that can create a chronic special needs plan. Keep in mind, just because one of these health programs or health issues are available for the development of a CSNP doesn't necessarily mean there is one. And more importantly to you, it doesn't necessarily mean there's one in your area in which you can market. The most common ones that we see deal with diabetes, different programs that are affected by our cardiovascular system, and we see some cardiopulmonary type of things as well. So you see in these different areas where, cancer, including pre-cancer conditions. I will confess, in my 18 years of experience with CSNP programs, I haven't seen one that dealt with cancer. So you have different programs here where that program might be a basis for a CSNP plan. Doesn't mean there is one. So how do we find out where they are? Well, we'll go through that in just a moment, but let's look at what makes a beneficiary eligible for a chronic special needs plan. Much as with the other MA programs, very similar to, they have to be entitled to Medicare Part A and enrolled in Medicare Part B. So it means they can't be too young or too old. Because keep in mind, we've got a sixth to a seventh of the Medicare population that are under the age of 65, and if they meet these other conditions, they may well qualify for a CSNP. It's also important to note that they've got to reside in the service area. We're seeing greater flexibility with a lot of the Medicare Advantage programs where they can access benefits out of area. But in order to be eligible for these programs, they got to live in an area where one of these plans are available. And it's also important to note that if a person moves out of that service area, they will be disenrolled from a CSNP, much as they would from any other type of Medicare Advantage program. It's also an additional caveat with these programs that just having that chronic condition, well, it might make them eligible, but in order to get them enrolled, that specific chronic condition for the program in which the person is applying has to be verified by their physician and has to be verified within a certain time period. So there are different ways that the companies will do so, but generally it's through a statement from the physician that has diagnosed the condition. So it's important to note then that you also have different special election periods available for this population, and it is a circumstance where if an individual has the condition, they want to join a CSNP, they can do so at any time throughout the year, but the SEP ends when they join that health program, be it a overall comprehensive program that includes the medical benefits or the drug plan. So we need to realize that folks can use the program for one condition, but if they have an additional condition that is covered by a chronic special needs program for that specific either mental or physical condition, they can use an additional SEP as well. So they have a SEP for each of the qualifying conditions. And the coverages will begin on the first day of the month after the submitted application, as we see as a general rule in the Medicare Advantage world. These plans can be of particular value to an individual because since they are limited to folks of one particular area because of the underlying condition that helps them be eligible for it, the programs are designed to specifically address that condition. So in certain circumstances, they may have additional healthcare provider choices with docs that will specialize in that particular illness. And the formulary, the drug list, that is a requirement on every SNP plan. You won't see a SNP plan that's an MA-only program. But the formulary that is part of what's offered to this population may well include additional medications to address that condition, or it may have medications that are laid out differently on the tiers of the coverage. There may be additional drugs, as I mentioned, that are part of that drug list as well. We also see in this area, too, a plan of care that is implemented for these coverages, and in most circumstances, they work with care coordination programs. So the the person that enrolls in these programs can maximize the benefits, the value of the benefits that are being offered by the plan itself. For us in this call, in this little room that we're using right now, it's important to note that, hey, you look across the board, 80% of older adults have at least one chronic condition. 77% have at least two. We saw on the previous slide, 66% have at least three. So there are a lot of folks out there dealing with healthcare issues, and many of those healthcare issues may well be one of the conditions that give us an opportunity to investigate the value of these CSNPs for that affected population. And you look at some of the top 10 chronic conditions that are based on fee-for-service beneficiaries within the Medicare world. Boy, 1, 2, 3, 4, 5, 6, 7, 8, 9, all of them. You got about 9 of the 10 that are one of the conditions that are listed as an underlying qualifier for a CSNP program, and it may well be the opportunity that we need to help them address the care issues they have for those chronic conditions. So the government does give us some help in explaining some of the programs that are out there for folks that have some of these conditions. So you'll look at this particular video that is posted on YouTube by the government that helps speak to the different programs for diabetes. This enables us to discuss this topic with some knowledge and with some background for our prospects and clients to give them details so they know what's out there, and then move into a presentation based on a CSNP program with the underlying qualifying factor of having diabetes. Same kind of circumstance for health circumstances brought about by heart disease. So information made available to us that not only is valuable to our customers, but in our studying of these videos and being aware of these benefits help us better explain the options that an individual has with Medicare. How do we identify where these are? Well, you've got a couple of different things that can come into play. We've got our own enrollment system that we'll talk about in just a moment, but many people are comfortable with and aware of the Medicare.gov site, even though a good percentage of them may not use it. And so we can actually utilize that site to help find health programs that will fit this category. How do we do it? Well, first, let's discuss with our prospects and clients why they can change. So looking into and visiting about the special election periods can be very helpful for us. But we can go into then and examine where these plans are available and how they stack up with their current coverage and other coverages that are available to them. Medicare.gov will ask us certain quick questions to help winnow down the choices that are available and helping identify these programs. And you can do so specifically by the area, obviously, in which that person resides. And you'll see here in North Texas, wow, there are a lot of MA plans available in Denton County. That's the county just north of Dallas-Fort Worth. And we then need to find out, are the special needs programs available in there as well? And once we do that examination, the choices will pop up and we'll see, like on this sample of the program that popped up first in the analysis done earlier, that it will lay out what type of provider chassis is part of it. This particular program is a HMO with a HMO POS option, and it identifies it as a CSNP program. That's how we can determine what plans there are and a synopsis of the benefits that are offered by that different plan choice. So if we look at Medicare.gov itself, bear with me a second, and we see that we can go into the programs, find different health and drug plan choices. In this circumstance, since we're looking just to identify where these plans are, we won't log in, we won't create an account. we want to basically look at some Medicare Advantage programs. Let's go back to my lovely example of it's the zip code I live in. And I am in Denton County. And we will say, I'm not certain. It's important to note that even if a person qualifies for a special needs program, they will still have value in many cases of accessing benefits they may qualify for under the LIS program, the extra help program, the low income subsidy program, because if those assistance programs with that bring greater value than the copays that are part of the drug benefit from the CSNP program, those lower copays will override just like they do in any other type of MA plan. So let's continue without logging in. We're not going to look at drug costs now because we are looking just to identify where these programs are, and you'll see the three choices that are there. So if we're looking for CSNP programs, we're going to want to look at the center one. We're going to want to add those special needs plans, and then the choices will pop up for us. And we'll see in North Texas, the carriers have put in a number of choices that help us, but please note that this isn't eliminating any of the other type of programs. So that's why it's important for us to know what identifies a chronic special needs plan, like we saw in the snapshot earlier. This program's not a CSNP. Neither is that. Neither is that. So you'll see that it'll list out a number of the plans, well, all the plans that are available there, but we need to identify which is actually that chronic special needs plan. So that gives us the detail on how we can locate some of these programs or these programs on Medicare.gov. There are other means of identifying some of these programs. We start with Medicare.gov because those are, that's the means that we can share the information with the public. But if we're doing our own homework, this is a valuable site that's out there that will give you detail on Part D and Medicare Advantage plans, including the SNP programs, where you can then roll into a state and it'll tell you the county Medicare Advantage and PDP counts for that particular location. So a ton of information is available for you on the government site, on different private sites, and we need to keep in mind that, with this information, we are preparing ourselves for the discussion with our prospects and clients. And it gives us then the opportunity to delve into specifics about that plan available for that individual that we're meeting, be it live or virtual. So it's very important for us to know the details of the plan and especially the network that's associated with it. If you have a chronic condition, you're probably having that treated by a specialist in many circumstances. Some cases not. There are a whole bunch of people out there with diabetes that don't see an endocrinologist. They deal with their primary care doc. So it's important to us to know how the individual can access the plan, the network that's involved, and who they're using. Those assistance programs, as I mentioned before, the Medicare Savings Program and the LIS program, keep in mind if we deal with Medicaid plans like the Star Plus program, which is the managed Medicare program, Medicaid program, here in Texas, these other factors may influence what may be the best plan for the folks that we're chatting with. Because keep in mind, just because they have a chronic condition, that doesn't mean that that overall coverage would be better met by perhaps a different MA plan, particularly if they're a dual special beneficiary that has one of these chronic conditions. You'd obviously want to access the plan that gives them the greatest benefit and does the greatest good. And so knowing about these assistance programs are crucial as well. It's important to note that if we're chatting with someone about a CSNP program, well, this may well be a longer appointment than a general Medicare Advantage plan. Might not be, but it could be. So we need to be prepared for that, and that's particularly important if we go into a household and we identify that they have eligibility perhaps for a DSNP. And so we're rolling into a much longer appointment, and it gives us the warning ahead of time. We need to be prepared for detail. It's also important to note that, hey, we had a whole list of SEPs that a person might qualify for. While a chronic individual, we mentioned they may qualify for one based on every chronic condition that has a C-SNP plan in our area. But there are other SEPs that other people can work as well that deals with changes throughout the year. We need to be aware of that, and have information available to help our discussion so the person has a solid, valid reason to stay with the program we're recommending. So that rolls back to our knowledge of the programs. It rolls back on the fact that we need to realize that a special election period can work both ways. It can help us put someone into a program. Someone else may use a different SEP to take them out. A lot of times when we deal with folks that are challenged by chronic conditions, they have caregivers within their family that are part of the decision process, and these folks may be very concerned about some of the other benefits that go beyond just co-pays and drug coverage. And that may entail the use of home health care agencies, durable medical equipment companies, and knowing those additional needs of our prospects and clients not only helps us guide them to what may be their best choice, but it also gives us the opportunity to make certain that the providers of these services are also part of the network. They've got to be that way, and we need to be aware of it. When you deal with chronic special needs plans, because they are specialized as well, it's important for us to have an open line of communication with the carrier offering the program and immerse ourselves into their training programs about their particular plan. You need to know what you're talking about specifically with these, because these folks have those special needs that are there. It's also important to note that the carrier helps us with different marketing and explanation of the benefits through different material, and the government offers some support as well. We'll identify that site for you in just a moment. So when you look at the different choices that a person has in an area, including the chronic special needs plans, we need to identify the benefits that are part of the program. Don't get caught in just a label. As I mentioned before, if a person has multiple challenges with their budget, with their health circumstances, just because something's labeled a program for people with diabetics doesn't necessarily mean that might be the best program for that diabetic that you're chatting with, because they might be a DSNP eligible as well, and that program may be more comprehensive in value than what we're talking about with the C-SNP program. And as I alluded to just a moment ago, it's important to look at all the providers of care for that individual. And that includes not just the doctors and the specialists in the hospital, but in many circumstances, those folks that are accessing those other areas of care that we may not think of right off the bat. We're concerned about driving down cost. It's important for us also to note what their durable medical equipment provider is doing for them. Are they part of a network? And that same circumstance also with home health care agencies that may be involved. Just because someone has a chronic illness, though, doesn't mean they necessarily use those services. And because they have a chronic illness doesn't necessarily mean they're really sick. They're just dealing with a circumstance, and it might come into a means of handling that condition as a qualifier and realizing that we're looking to enhance their programs because of what qualifies for them, but they may be still valid prospects for us in other areas of insurance. We'll talk about that in a moment as well. And we'll see that also the carriers that offer these types of programs and have done so consistently most often have solid support in your market to help you market these programs. and different materials that are there to help you market as well. But as importantly, they will offer different trainings to help you become not only conversant on these programs, but adept at identifying how these can benefit the prospect and client with whom you are visiting. As I mentioned, the government gives us a whole bunch of additional detail, resources we can use to investigate these programs and the area in which we're operating, so we can offer a valid, educated presentation on these plans. So you got some help from the government that'll do it. And this is the site that I was alluding to earlier, where the government actually has a program that enables us to go in as advocates for care for the population and get additional material from the government. This is a great place. If you haven't gone to this and registered, it is where you can actually order calendars from CMS, and 50 of them each month can be, that's the max you can order at a time as an advocate, can be sent to you without cost, as are the other marketing program or the other marketing material or informational material from this site is available without cost as well. This is where a Medicare and You handbook is available as well, but I got to warn you, you can't order them in bulk through this. They'll kick you out pretty quickly. But it's a great way to get additional information, perhaps some material you can use as giveaways, those calendars specifically, a great way of utilizing a third-party influencer, the government, CMS, having material made available to you. Because remember, whatever we're doing with any type of Medicare Advantage program, we're taking it back to the Medicare population overall. We can't put all our eggs in one basket. We got to realize that one size doesn't fit all regardless. As I mentioned, just because someone has a chronic illness, we need to go through and investigate the full portfolio of product available for them to make certain that we're best addressing their situation. And as many of us have discovered over nearly the last year, can you believe it, 10 months now, where we have been affected by the pandemic and COVID-19, we have seen a great increase in the electronic savvy of the Medicare population. And it's being helped by a number of different circumstances. First and foremost, a number of folks like you that are reaching out to people and then doing Zoom calls or doing the different types of outreach electronically to visit with people about their choices. But if you look at it from a practical application in your own life and the people that you deal with, many of the providers of care have gone to an electronic system as well. I have different health issues. A number of different doctors I have actually had telehealth visits with, where either a smartphone or a tablet or a laptop or desktop can be utilized for a doctor visit. And there are certain doctors that are still only doing visits in that fashion. So we have providers of care that are helping train the individual as well on the different tools that we can utilize to reach out and help folks as well. And so while there may be a portion of the population that don't have the technology or the wherewithal to use it, if they had it, a good percentage of them do now. And so we need to be aware of the fact that, hey, an in-person meeting with this individual may not be possible, but a virtual meeting can help as well. And gee, a whole bunch of these folks are using Join Me or different types of systems as well to chat with their family. So that proficiency may well be there, and we need to be aware of the fact that we may need to pivot from an in-person to a virtual type of presentation. With Premier Marketing, we do also have made available without cost to our agents that are contracted with us, the Medicare Center program. And this is a great program for an agent to use with a CRM available as part of it, but it's a single sign-on to 3 different quoting systems. And it enables you to collect, we'll send out the request for and collect and store that scope of appointment for that 10-year period. And remember, we're supposed to do that if we sell that individual or not. So we have that available for us in this circumstance. It also gives us the opportunity to send material electronically and discuss it thereafter, and do so where we're doing a side-by-side comparison of up to 3 different programs in an area. So if you're dealing with a chronic special needs individual, it enables us to identify that plan and other choices in that area that may be appropriate for that individual. It also gives us a means then of enrolling those folks electronically as well, and creates that microsite for you where you can drive individuals to your version of Medicare Center, where they can do some investigation on their own and enroll on their own should they choose to do so, where you get credit because that site is linked to you and what you do. It also gives us the opportunity then to discuss different programs that may enhance the base coverage in which they're enrolling. And by doing so, we're driving up our retention. If we have multiple products in a household, we see that the folks will stick with us in greater numbers. And it's important to note that they don't have to be with all the same company. So you might do a base program with a Medicare Advantage carrier and add on dental insurance, or add on a hospital indemnity program with a different carrier. And as you have more product in that household, your persistency grows, your salary year over year, and it drives up the retention for you with your product base. There are also different programs available out there. This is an aside, a singular mention of this, where there are guarantee issue products for life insurance as well, and that may well be a topic that is brought up by our discussion of their chronic conditions. Now keep in mind, because chronic special needs programs require that scope of appointment before discussion and to keep on file, it limits our discussion of the different products that can be available. So we need to make certain we're using a generic scope of appointment that lists the different health programs that can be discussed during that appointment. And then if the discussion goes to life insurance or final expense, we need to realize that that can't be part of a follow-up to our MA or PDP conversations during that same appointment. It would require an additional appointment, but I think you'll find that it best serves the people we're discussing coverages with, and we're looking for their overall security as well. So some of these additional things that you'll see because of working with Premier with these special needs programs, you'll see that we try to make it as easy as possible to contract. This particular software package enables us to create an agent profile where we can put in all our information, answer the questions we commonly see on the contracting material that is sent to us by the different carriers. It gives us then a place to store our E&O, the different pieces that can come into play that are requirements for us to contract with different carriers. This enables you to do it efficiently because you're doing it electronically as well. Keep in mind, one of the reasons why carriers really like e-apps is the fact they don't have to read our handwriting. This does the same thing for you in the contracting world as well. And since the vast majority of all the programs out there require you to have errors and admissions coverage, we do also have a program for you to purchase discounted E&O coverage that covers you regardless of the insurance program that you are offering and the hierarchy you're contracting through to offer that program. You own it. So it's not like being added to a blanket E&O program for just one program and you have to worry about where the coverage is going to be for everything else you do. This is what you own. It covers you if you contract with Premier or any other marketing organization for a particular insurance product. We also have an arrangement with WebCE to make certain that your license stays in play by offering discounted continuing education courses, and you have an opportunity as well to add to your own benefit package with a modified guarantee issue program for DI. for disability income. And it is a program that you're paid commission on as well. Much as where today's presentation is being recorded and will be sent to everyone who has expressed interest in today's presentation, those recordings are also available on our training library on our website at premiersmi.com, as noted here, and on our YouTube channel as well. So these include not only topics of a particular notion like a chronic special needs plan. They may be available on selling MA in general, selling Med Sup or other ancillary products. It may be also recordings of carrier-specific examples, but there are also different programs in there that speak to different marketing tips and concepts that can be very valuable for you. And of course, then, because it's the World Wide Web, they're available for you 24/7. I cannot express or stress enough how valuable the Medicare Center program is to the agents that we deal with. It's a great way for you to expand your reach into the community, enlarge your propinquity, the area of influence that you can make use of. It can change the way you do business, plain and simple. And regardless of how long the current pandemic rolls on or how that affects the population moving forward, we'll never go back to the old normal completely. There are going to be folks that are trained in the electronic access that want to continue to do that. There are going to be people that are wanting to do face-to-face as well, but this program enables you to deal with all of the population and do so efficiently, effectively, and compliantly through this tool available to you without cost. And that gives you the information. It also gives you access to one of the systems, and it's the CSG program with whom we contract, that enables you to also look at data in the Medicare Advantage world and when it comes to penetration into your particular market, but also a means to cross-sell. Because there may be circumstances that you are visiting with an individual and you go through the base medical coverage. Is it best for them to have a Med Sup? What Medicare Advantage programs are in the area? How can they best serve an individual? And the person may love your presentation, may love you, but they may love the program they have in place now more than either of those options. And then what do we do to make certain that we cover them completely? Well, if it's a Medicare Advantage plan that they're currently on, there is a program within this system that helps you speak to hospital indemnity programs and how they can fill those gaps in that Medicare Advantage plan that they have in play. So a great way for them to cover themselves completely, a great way for you to augment their coverages and create a sale. There is a recording of this concept that will come to you as part of the follow-up as well. Keep in mind, even though I did that presentation, I'm not as chatty on that one as I am on the webinars, so it's much shorter. And it goes through and it speaks to it in detail. So you'll find as well that many of the ancillary programs also have different incentives that help us with the marketing of that program or rewards us for doing so. Medicare Advantage plans, including CSNPs and PDP programs, well, that's not the case. Government sets the maximum compensation that can come into play with those programs, so we don't see them as often or ever, should we, as part of an incentive program for trips or additional marketing dollars. However, some of the ancillary programs or the other insurance programs that you offer may do so. We have that information in a singular site point of view for you on our website as well to make certain that you realize all of the compensation to which you are entitled and that those programs also make you eligible for the different premier incentive programs as well. We have traditionally done a cruise. This last year that changed, and you'll see that this particular slide shows how a person could have qualified for up to $4,000 in cash based on what they did with our organization last year. You see programs like this rolled out with our organization with consistency. Some of the things that we also do to help you is getting in front of these individuals. We have a contact list that's available to you at low or no cost where you can smile and dial for certain programs. Hey, we're talking CSNP, can't smile and dial for them, but you can for dental coverage or med subs or even final expense, a number of different programs that are out there. We also have different programs in play that help you maximize the value you have if you participated in a retail marketing program in the past or ongoing. If you're using centers of influence in the community, such as faith-based organizations, or reaching out to the providers that are delivering the care for the programs that we're selling. Great way for you to utilize the community, and you can do so virtually as opposed in addition to the live types of meetings. Because in many of these circumstances, these folks are doing that as well. We talked about providers doing appointments virtually. You'll see the different faith-based organizations across the board in many circumstances doing services virtually. So there are things we can do to help them spread the message of the programs we have available that are of value to that population. If you worked with a carrier consistently as well, they may well be generating prospects for you too that you want to utilize. You see this most often during AEP with the Medicare Advantage carriers or PDP carriers, but you also see that throughout the year with carriers we work with for DSNP or CSNP programs. So we want to make certain that we're accessing those lead sources as well. We do offer internet lead programs and direct mail support. The direct mail support is based on production, where you're discounting the cost of these mailings on a consistent basis, and this gives us that opportunity to do this consistently, because direct mail is kind of like your exercise program. You do it once, well, you're paying for it. You might get a little bit of benefit, but you're feeling some pain. If you do it consistently, that's where you're going to see the value of the program, and it gives you the opportunity to utilize your production as a means of driving down your expense in this area. We use certain vetted preferred carriers or vendors in order to access this support, and we do so in order to make certain that we're helping keep you compliant in what's going out and utilizing it for you. We do also have a couple of programs that enable you to not only direct an entire mail campaign like what we just mentioned, but also purchase some of the responses off of different mail campaigns that are out there through different vendors. This can be very helpful for us, particularly if our budget's a little crunched right now, but keep in mind, if you're doing and directing your own mail campaign, you're getting your responses same day with these lead vendors that we're using. When you purchase a response, that may be a little more dated of a response, and it's regardless of how you're accessing that response, you're not getting that same day type of program. If you're looking for Facebook lead programs, we have that as well for final expense and Medicare. Very helpful and been very successful. The final expense people use this in great detail and can be very helpful for you. All that said and done, we're throwing all this information at you very quickly. We're almost at the top of the hour, and I want to make certain that I look at the questions that are there. But we're trying to make certain that you have the knowledge at your fingertips, the detail that you need in order to properly address the variety of people that you're meeting on an ongoing basis. But it's also a means here in the chronic special needs world that give us an opportunity to reach out to people and visit on a year-round basis. Because remember, that SEP's in play if they qualify based on their chronic illness and the other factors we talked about on a continual basis. It helps you drive your business, and we want to be part of that business. So if this is something that is of interest to you and can be of value to you, make it part of your marketing program. Be prepared to offer the programs and move forward with it. So let's look at some of the questions that may have come in. One of the questions, what is a what's the CRM stand for? That's the customer database. It's the software program where you can put in the information about your prospects and then access it conveniently. Some folks are using Excel sheets, some even use Word documents. A system like this can really be helpful in organizing your business and making certain that you can follow through and access that information throughout the year. It comes as a complementary part of what we're offering. We appreciate some of the other pieces of, pardon me for just a moment. Another one popped up here. The question is, will the PowerPoint be available? Yes. As part of the follow-up that comes out to today's presentation, you not only have a link to the recording, but you will have a copy of the PowerPoint as well. If this is an area where you are accessing marketing material, we have presentations that are available as well. That's where we deal with many of the carriers and make certain that we are presenting the programs in the fashion that they dictate. To feel, hey, it's my ball, use it or go home type of thing. We want to make certain that we're delivering it with information that is available in an area. There's nothing like teasing somebody with a generic presentation. They don't have a CSNP available in their zip code. Hey, we've kind of opened a trail of discussion, but we want to make certain that we're doing the best for our prospects and clients. Another question, if the prospect is utilizing medical care and getting prescriptions through the VA, does that present a problem insofar as applying for a SNP? Robert, nope, it doesn't. It doesn't create a problem. It does create additional discussion and instruction, because if a person enrolls in a CSNP and they are prescribed a medication and that person goes back to the VA to have it filled, well, keep in mind the VA doesn't honor the civilian prescriptions. They'd have to have that script rewritten by a doctor affiliated with that VA location or with the VA in total. So it doesn't interfere. It does create additional instructions that we need to deliver to our prospects and clients to make certain that they understand how to best utilize all the resources they have available. So all that said and done, we're a little bit over the time. I apologize for that. You can reach us at Premier through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. You can also respond to the follow-up we're going to send to this, and we'll make certain that folks reach out to you and handle the questions you may have, because, hey, one always pops up when the guy's done talking, right? Well, we'll make certain that you have the information you need to properly offer these programs and make it part of your overall marketing strategy. We'll reach out to you to make certain that we are accommodating your interest in this area across the board. And that includes not only the programs to address their health, but perhaps remember that little life insurance one slide we had in there could be really helpful for you in dealing with this population as well. All that said, I want to thank you for the investment of your time today. If you are currently contracted with our organization, we thank you for that relationship and for any business that you have generated with us as well. It's greatly appreciated. And until we're able to visit with you again about this and other programs, we're going to wish you good selling. Thanks so very much, and we'll talk to you very, very soon. Have a great day.